I'm Dr. Blake Staub. I'm a neurosurgeon at the Texas Back Institute. I decided to become a doctor really because my father's a doctor. The few times that I did go with my dad to see deliveries and to kind of hang out with him in the office, just seeing the connection that he made with patients really inspired me to follow in his footsteps. And then once I got into med school and started seeing patients, it kind of, a light just went off, and really I was hooked on the change I can make in someone's life. And it's just really something I thought I had to continue for the foreseeable future. I think with both brain and spine surgery, especially 10 years ago when I was really deciding what field to go into, there was so much unknown. And I thought it was really exciting to go into a field where I could really help kind of develop where we went as a field. In addition, I like the idea that people can get better immediately. The first time I did a microdiscectomy, and I was so nervous. I was doing this case by myself, and I went and saw the patient in the recovery room afterwards, and there were tears of joy. They were so happy that for the first time in 6 months, their leg pain was gone. And that sealed the deal for spine surgery for me. I've never seen a patient so grateful before. And I immediately said, this is something I have to do. I want to experience that look on a patient's face over and over and over again. So the technology in spine surgery has really taken off over the past few years, specifically from robotics to intraoperative CT scans to all sorts of advanced navigation systems. We pretty much use all of it at TBI. And it really, growing up as a child in the 90s and 2000s, technology is what I do. And so it's so much fun to integrate these new computer programs and whatnot into my day-to-day work life. And I've really gotten, during my fellowship, a great experience with a new software program that helps me kind of calibrate exactly what a specific patient needs. And I can take all these specific measurements and apply them to you and really make sure you're getting the correct surgery the first time, and make sure that you're not going to have to come back to have revision after revision after revision. When I'm not at the hospital or taking care of patients, I spend all my free time with my family. I have 3 little boys, so it gets a little crazy at my house. We're constantly wrestling and playing sports and doing all sorts of other fun boy things. My wife is kind of the savior of the household. She keeps everything in check and keeps everyone in line. She's also a physician. She's an anesthesiologist. She's an amazing doctor, also an amazing mother. And seeing my boys grow up and seeing my wife just kind of run the household, I can sit back and just let things go. It's been an awesome experience. And just, being a father is a lot like, being a doctor. You have to be calm and compassionate, and every once in a while, lay down the law. And really, I've been able to kind of build off of both things to become better at the other. I chose Texas Back because the research done here is groundbreaking, and at the same time, the surgery done here is groundbreaking. And that's where I needed to be. As a neurosurgeon, I had the opportunity to also focus on brain surgery, but in a big city like Dallas, or the Metroplex in general, I thought it was really important to super subspecialize. I need to give my patients the very specific care that their spine deserves. And if I were spending my other time doing other things, I wouldn't necessarily be as good of a spine surgeon as I am now. And I think Texas Back affords me the opportunity to simply concentrate on the spine and utilize all my neurosurgical training on the spine as opposed to on the brain as well. When I think back on my legacy 30 years from now, I really hope that people see me as an honest, compassionate doctor before anything else. I think the most important thing we as physicians can sometimes forget is that the patient comes first, and really the most important thing is the relationship we can develop with the patient.